Welcome, everyone. This is Dr. Glenn Hoey, naturopathic physician, with our second segment of our Facebook presentations. Thanks for listening in or watching, as the case may be. This is Heart Health Month. This is February. Last week we talked a little bit about libido as a result of, it was Valentine's Day and the idea of romance and such, and some of the things that affected libido, and some of the things that were important in improving it. That was hormone therapy that we use quite a bit here, and there are certain medications that tend to take away from the ability to produce sex drive. So I wanted to talk a little bit more today about overall heart health from more of a preventive perspective, from more of a protective perspective, because we don't really talk that much about things that you can do for your heart. Most of the discussion is oftentimes about what to do when you have a heart attack or when these things are happening. What we want to do is prevent that, and we work more in the preventive sphere here. So without further ado, I'm going to talk about nutrients and also the benefits of hormone therapy in cardiovascular health. First up is omega-3 fatty acids. They're extremely important nutrients. Omega-3 fats are naturally anti-inflammatory and anticoagulant. So, and they come from things that swim, essentially. So if you're a fish lover, salmon is a major supplier of omega-3s, as most cold water fish are, but pretty much anything that's coming from the sea is going to have a pretty decent amount of omega-3 fats. Now free-range eggs and pasture-fed or grass-fed beef products are supplying more and more of the omega-3s. These were foods that were naturally done 2-3 generations ago, and when organic wasn't really a buzz term, or free range or pasture fed are now the buzz terms. These were things that just grandma and grandpa did normally on their farm. So omega-3s are extremely important, and they also come from certain nuts like walnuts, and then you can supplement them with usually 1,000 milligram supplement of fish oil or krill oil. And I usually recommend, if you're going to supplement 2 to 3 capsules or 2 to 3,000 milligrams a day, or you can use the straight fish oils. A number of people have commented favorably on like the lemon flavored fish oils and have gotten their numbers up very significantly. When we run labs for omega-3s, the optimal levels is 5.5% in blood or higher. Most of us are lucky to run 2.5%. So omega-3s are extremely heart healthy. So keep that in mind. Next is coenzyme Q10. And this is a very, very important nutrient for your heart. Interestingly enough, there are cardiologists who would recommend that if you are taking a statin, that you should take coenzyme Q10s, because statin medications have a tendency to deplete or interfere with coenzyme Q10 production. And it's a very simple nutrient. Usually 100 to 300 milligrams a day is helpful. My recommendation is to get off of your statin. I'm not a huge fan of statins. I don't think that they are that healthy. I don't think that they generate the heart benefits that the medical community thinks that they are doing. But coenzyme Q is a very, very important nutrient in and of itself. Another huge nutrient there is magnesium. Your heart is a muscle. It requires neuromuscular activity. And magnesium, anywhere from 200 milligrams 2 to 3 times a day, provided it doesn't turn into a laxative for you, is very, very heart healthy. It's oftentimes given at the time of a heart attack. So because of its neuromuscular benefits there. So magnesium is extremely important. I rarely recommend calcium as a supplement, because calcium can have a tendency to show up in places in your body where we don't want it, which could include the internal aspect of your arteries. That's one of the things that helps form plaque. So we don't want to use that. So another really heart healthy nutrient that indirectly works that way is vitamin K2. Vitamin K2, relative newcomer on the block for the nutritional world here. Typically, we know fat soluble vitamins is vitamin A, D, E, and K, K1, which is assisting the clotting process. But vitamin K2 is unique in what it does, as it assists calcium in removing it from areas where it's not supposed to go and putting it in areas like your bones and teeth where it is supposed to be. So that is another critical heart healthy nutrient there. Sodium and potassium are extremely important nutrients as well. We have a tendency to be critical of sodium, to kind of bash it, which is unfortunate because it has many, many roles in the human body. One of which is, I believe, immune system function. It's a natural antimicrobial, but it's also a very important electrolyte along with potassium and calcium and magnesium, because all of those nutrients there are important for your heart rhythm and regulation. So don't forget about electrolytes there. When we get hot and we just think about drinking water, we need to replenish our salts too. Quite a few of us there crave salt, and there's nothing wrong with that, so don't feel guilty about wanting to consume salt or foods that have salt in them. Your body has a wonderful regulatory process, including hormones and such, and gastrointestinal function to keep sodium and potassium levels in the normal state. So if you're craving salt, by all means, use it. It's very important for your health, absolutely. So those are the main nutrients. There's 100 nutrients that you could say are here, but I wanted to focus a little bit of time on testosterone, on estrogen, and on thyroid, especially T3 thyroid. These hormones have been oftentimes, again, criticized and in the medical community because there's so much fear mongering about causing cancer or causing this, but these hormones are the most important ways of actually reducing the plaque in your arteries. There is no medicine that Big Pharma has made that will do the job that estrogen will, that testosterone will, and especially liothyronine T3. Question in the audience.
We had a particular question regarding thyroid issues in women.
Well, women have a lot of thyroid issues. Absolutely true. And I'll answer that quickly. Most of the time, women are going to find themselves in the normal reference range for thyroid hormone evaluation. Our clinic is unique in that we rely heavily on more signs and symptoms and tend to set aside the standard TSH, the thyroid stimulating hormone test, is the gold standard in conventional medicine. Thyroid stimulating hormone really isn't a thyroid hormone, it's a pituitary messenger to your thyroid. So quite often you will exhibit the signs and symptoms of low thyroid, which would include fatigue, weight gain, dry skin, thinning hair, elevated cholesterol levels, and it's one of the things that will segue back into the cholesterol issue, the cardiovascular issue with thyroid, because we're seeing an interesting relationship. The lower the thyroid, the higher the cholesterol, the more likely we're going to see cardiovascular disease. So as we treat cardiovascular disease, we treat it primarily with T3, but we like to use desiccated thyroid hormone, which has both T4 and T3 in it. And this is a product that has been around like 100 years, and it's just merely fallen out of favor in the medical community. It was not dangerous, it wasn't causing deaths, it wasn't anything like that. It's just simply the way products are introduced into the medical community and heavily marketed. And what got heavily marketed were the synthetic versions of T4. And that is what your conventionally trained doctor is used to using, is a conventional synthetic T4 hormone. Unfortunately, the T4 doesn't do nearly as much as optimal levels of T3, and that's in the medical literature. And I wish to repeat that and underscore what we are talking about here are decades and decades of medical literature studies showing these things happening over and over again. So T3 is a wonder hormone for men and women alike. Women tend to have it more because they've generally had children. If they've had 2 or 3 kids, usually the thyroid levels are going to be much lower than optimal, and you can decide for yourself if you have a number of the symptoms that I mentioned there. Low energy, like Dr. Hoy, I'm tired all the time. I can't seem to lose this weight. My skin is dry. I just don't have a lot of motivation. We'll call it depression, but it's oftentimes just low motivation. And many times they're coming in on an antidepressant, they're coming in on a statin because their lipids are elevated, and all of that is connected to your thyroid. All of it is. That's how it works. And we do marvelous work here. And it doesn't matter where you are in this country or in this world, we can work with you. Phone number is area code 509-662-1302, 509-662-1302. We tell people if you've got a phone, if you have a lab somewhere near you, and if you're in the United States, we can get you to a Quest lab and get our actual profiles done and sent specifically right to us there. And you have pharmacies, either standard pharmacies or compounding pharmacies somewhere near you. We can be up and running with you and turn your life around because we do it every single day. So thyroid we talked about there. I hope that's answered that question. It's funny, guys come in sometimes and they're on testosterone, and the very first question their provider's asking them is, why are you on testosterone? And I tell them, remember this, it is probably the single most important heart medicine you can have, and that is testosterone. And for women, it would be estrogen. And when we see women come in who are postmenopausal, the very first concern I tell them is that you are at greater risk now for heart disease, cardiovascular disease. Absolutely, because now your estrogen levels are falling. Same thing with men. We're seeing men now, we're seeing it now in their 20s and 30s having lower levels of testosterone. But as we're getting older here, testosterone levels are falling even more. And testosterone is critically important for, again, clearing plaque out of the arteries. And there have been wonderful studies looking at what we call carotid artery thickness, where you can take a simple ultrasound and do easy studies to see if there is plaque forming in an artery. And these carotid studies show over and over again the benefits of hormone therapy reducing that plaque. Interesting, when we have studies showing statins use, statins, even though they're lower cholesterol levels, have never been shown to reduce plaque. So all we see are lower cholesterol levels. And for a lot of people, that's a big problem. So testosterone and estrogen are both wonderful for reducing plaque in the arteries there. So it's incredibly important to have your hormones checked here. And we're one of the few places, that will do that. You need to find either a very, very holistically oriented doctor in your area, or like I said, you feel free to contact us through our Facebook page, through our phone number. We can improve your health dramatically. We have incredible results every single day. It's a joy to do it. I can't tell you how much fun it is to watch people's lives turn around in the course of a few days. Even women on estrogen, progesterone, on thyroid, within a week, 2 weeks, just can't believe how much better they're feeling despite years and years of talking to their provider. I'm so tired, it's this, it's that. Well, you're in the normal range, you're fine, here you can take an antidepressant, or and I feel badly for them because they're stuck in that situation. And we have the luxury then of observing the medical literature and saying, well, this is what doctors did 2 generations ago. They just basically decided to put you on natural thyroid and see if it worked. It was just called a therapy trial. I like to use the word hip shoot. It's a therapy hip shoot is what it is. And if you felt better, good. And then we would just simply dose it until the point of you getting better. And that's how it works here too. We pay attention to you, and that's what's so critically important. So I hope this has been helpful for you. I mean, this is, like I said, this is Heart Month and such. And we wanted to really pay attention to the things that will benefit your heart the most. You can implement these things anytime in your life. You can be 90 years old, whatever. We have people 90 years old taking hormone therapy. It improves dramatically the quality of their life. So there's no reason why, no matter where you are starting, at 40, 35, at 55, that you can implement these strategies here, get out from underneath some of the medications that you were taking for blood pressure, for lowering your cholesterol, which I think is not a very wise idea, personally. And we'll go from there. So until next time, this is Dr. Glenn Hoey. Thanks for watching.